Dear friends, welcome to Know Thyself YouTube Channel. Good morning. Hope you are all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last two episodes of Know Your Mind segment, we presented an overview of personality disorders and briefly considered their types and groupings. In this episode, we analyze the first type of personality disorder, namely paranoid personality disorder or PPD in detail. Paranoid personality disorder belongs to the group of odd or eccentric personality disorders, which involve unusual, peculiar, and strange thoughts, feelings, and behavior. Paranoid personality disorder is a mental health condition which involves being paranoid that the others are out to get you. You suffer from an observable, relentless, and long-term pattern of mistrust and suspicion of others without adequate reason. You are always on your guard as you believe that others are spiteful, trying to demean or threaten you, even though there is hardly any reason to suspect that they would do that to you. Since paranoid personality disorder decreases your ability to identify and recognize your role in a conflict situation, you often assume that other people would harm, manipulate, exploit, and deceive you. It is normal for you to experience some level of paranoia in certain situations in life, such as worrying about strangers while walking on a poorly lit road at night. However, affected by paranoid personality disorder, you take it to the extreme and feel suspicious of people in virtually all situations, both in your personal and professional life. Hence, you find it difficult to trust others and confide in them. Instead, you project your feelings of paranoia as anger and irritation onto others. When you have paranoid personality disorder, you may display the following symptoms: doubting the commitment, loyalty, trustworthiness, and motives of others. Believing that others are exploiting, deceiving, or harming you. Reluctance to confide in others your personal information because of the fear that it will be used against you. Unforgiving and holding grudges. Being hypersensitive and taking criticism poorly. Reading hidden meanings in innocent remarks or casual looks of others. Perceiving attacks on your character that are not apparent to others. Having persistent suspicion without justifiable reason that people close to you, such as your spouse, business partners, and friends, are unfaithful to you. Being cold and distant in your relationship with others. Not seeing the role you played in a conflict or in creating a problem. Believing that you are always right. Having difficulty in relaxing, being hostile, stubborn, and argumentative. And expressing anger and hostile reaction to perceived slights or insults. These symptoms begin to appear in your late adolescence and early adulthood. However, their full impact on your thinking and behavior is experienced during your mid or late adulthood. When you have paranoid personality disorder, you are often cold, distant, and withdrawn, having trouble getting along with others, and experience significant difficulty in building and maintaining close interpersonal relationships. Your inappropriate and excessive hostility and suspicious attitude towards others may manifest in recurrent arguments, antagonistic indifference, or social detachments. Since you are always on the lookout for potential threats, you will behave in a secretive way that would appear as devious and tricky. Other people may begin to experience you as emotionless, unfriendly, and unsympathetic. You tend to have a deep need to be self sufficient and in control, which might lead you to dominate and exert control over others. Your combative and suspicious attitude will eventually cause others to respond to you with hostility and unfriendliness, which in turn would reinforce your imagined suspicions and distrust about others. Thus, paranoid personality disorder can cause you to exhibit a lasting and permanent pattern of inner thoughts, feelings, and external behaviors that fall outside social norms and practices. And often you neither acknowledge nor accept that your way of thinking, feeling, and behavior are problematic and socially unacceptable. Hence, paranoid personality disorder can eventually lead you to considerable distress as it can impair your functioning and success in social and professional settings, though it may not happen until you reach your 40s or later. You may need the assistance of a therapist to help you trace this pervasive and inflexible pattern of thinking, inner experiences, and external behaviors back to your late adolescence or early adulthood. It is important to note that people with paranoid personality disorder do not experience delusions or hallucinations along with their paranoid condition, as commonly seen in psychotic disorders such as schizophrenia, schizoaffective disorder, or bipolar disorder. Paranoid personality disorder is relatively rare and affects 0.5% to 4.5% of the general population. It is more common in men than in women. Genetic or biological factors such as hereditary transmission or family history of psychotic disorders and environmental factors such as childhood emotional neglect, physical neglect, and supervision neglect can contribute to the emergence of paranoid personality disorder in late adolescence and early adulthood and its fruition in the mid and late adulthood. Since the above mentioned genetic and environmental factors affect a person from childhood, the emergence of paranoid personality disorder cannot be prevented. However, it can be treated, though often diagnosis becomes difficult as affected persons do not think that they have a problem with their thinking or behavior and rarely seek help on their own. Treatment includes medication, appropriate therapy, or both. Often a lifelong treatment may be required. Medication may serve to calm violent symptoms, while therapy focuses on increasing general coping skills, especially trust and empathy, and improving social interaction, communication, and self-esteem. Since trust is an issue for people affected by paranoid personality disorder, they may not follow the treatment plan provided by the healthcare professionals and may even question their motives. Hence, success of the treatment calls for the persons affected by paranoid personality disorder learn to trust their therapist, accept the given treatment plan, make a lifelong commitment to it, and follow it on a daily basis. Leaving untreated can worsen the affected person's mental health condition. In the next episode, we will analyze the second type of odd or eccentric personality disorder, namely schizoid personality disorder, in detail. Thank you for watching this video. Stay blessed until we see you again with another video.